How can I safely determine what level of physical activity or exercise I can tolerate if I'm living with long COVID-related breathing problems? Before starting any exercise program, always get tested first by a physical therapist or other specialist to see if you're at risk for post-exertional malaise, or PEM. Post-exertional malaise is defined as, quote, the worsening of symptoms following even minor physical or mental exertion, with symptoms typically worsening 12 to 48 hours after activity and lasting for days or even weeks. PEM can be mitigated by activity management or pacing. The goal is to avoid PEM flare-ups and illness relapses by balancing rest and activity. End quote. If you are able to tolerate exercise, a type of exercise that is referred to as Cardio-Respiratory Rehabilitation, or CRR, may help in your recovery. Any program of this type should be designed to meet your specific individual needs and to be adjusted to address your personal symptoms. Before starting, a therapist can test your initial exercise tolerance level and plan a program together with you that is adapted to your specific long COVID-related breathing problems and any other symptoms you may be experiencing. Then they can monitor you as you begin to exercise. Your therapist can also monitor your heart, your oxygen levels, and any fluctuations in your blood pressure and heart rate when sitting upright or moving from sitting to standing. You should also inform your therapist in case you notice any changes in your body temperature, if you start to sweat a lot, or if you feel any dizziness, lightheadedness, or chest pain. You don't have to do all the exercises in your suggested program right away if you feel that your breathing is getting worse. Instead, try to gradually increase your exercise while noticing if there is also any increase in your symptoms. You may feel tired after a workout and even the next day, which is normal, but you should recover quickly. If you're not recovering or are feeling even more exhausted than normal, make adjustments to the amount of time you exercise and the intensity of your program to reduce your risk for post-exertional malaise, or PEM. Here are a few examples of CRR-type exercise programs. 1. A 50-minute exercise plan. 30 minutes of walking, 10 minutes of strength training, 5 minutes of balance and posture-related activities, and then 5 minutes of gentle stretching. You can try this plan 3 times each week for 4 weeks and see if that's a good amount of physical activity for you. Another one. This is a balanced mix. Try some aerobic exercise and some strength training in a way that fits your personal tolerance level. Try this for 5 or 6 days each week for 5 or 6 weeks. Finally, you can use a conscious rhythm of exhales and inhales as you exercise. In strength training and cardio workouts, inhale through your nose and exhale through your mouth. In general, you can exhale when you're using resistance, like lifting a weight above your head, and inhale when you release the weight back down again. Avoid holding your breath or interfering with the free movement of your ribs and torso, particularly in your sides and back as you're breathing and exercising.